My name is Callie Hunter, Skills Lab Coordinator at North Central Missouri College, and today I'm going to be demonstrating how to do a focused cardiovascular assessment. We're going to say today that we're taking care of a 55-year-old female in for congestive heart failure. Okay, so first thing that I would do upon entering the patient's room is introduce myself. My name's Callie. I'm going to be your nurse today.
Okay.
And today I would like to go ahead and perform a focused cardiovascular assessment on you. I'm just going to wash my hands real quick, okay?
Okay.
So I'm going to wash my hands. And can you go ahead and tell me your name and date of birth?
Brooke McAtee, 129XX.
Okay, very good. And Brooke, I see that you're in today for congestive heart failure. Is this something that you've had for a long period of time?
I was diagnosed probably about around 6 months ago.
Okay, very good. Are you taking any medication currently for that?
I'm taking, let's see, lisinopril, I think it is called. And there's some water pill thing that makes me pee.
Okay.
And then I take like a potassium supplement.
Okay, very good. Did they explain those medications to you whenever they prescribed them?
Well, I know that lisinopril, I've taken lisinopril for a long time because I had high blood pressure.
Okay, good.
But the other
So you've had high blood pressure for a couple of several years?
Yeah.
Okay,
yeah.
very good.
But the others I don't really know much about. I just know that one makes me pee a lot.
Okay, the Lasix, what that does is that helps rid your body of excess fluid. And so that is going to make you urinate frequently. The other thing that does is it kind of flushes a lot of your electrolytes out of your body. So it does deplete the amount of potassium that's in your body. So that's oftentimes why they do go ahead and put you on a little potassium supplement to kind of make up for that volume that you've lost. Okay, so that's very, very common. Okay. Are you having any difficulty breathing right now?
Not right now.
Okay, and I see that the head of the bed is elevated.
Yeah.
Okay. So I'm just going to go ahead and get a set of vital signs on you just real quickly. So I would go ahead and obtain her blood pressure. Okay, we'll say at this point it's maybe 130 over 78. Okay, so we'll say that that's okay. We haven't given her medications yet today. Are you experiencing any headaches, dizziness, anything like that?
No, not really.
That would be maybe a concern if the blood pressure was extremely high. That would be something that we would be concerned about, but she's not symptomatic at this point. I'm going to go ahead and obtain her pulse. We can say that it was maybe slightly tachycardic, just a little bit. We'll say maybe, or maybe just on the high end. Let's just say she's about 95. Okay, so she's good that way. I'm going to go ahead and assess her pulse oximetry. We'll say that she is 95%, okay, at this point. If she was low, I was concerned about her breathing. She's not labored at this point. I would maybe go ahead and provide some supplemental oxygen. At this point, I don't think that it's necessary. Brooke, do you wear oxygen at all at home?
I do off and on. Like when I usually get short of air short of breath when I get up and move around and I'm up for a long period, doing something.
Okay.
Getting up to the bathroom.
Okay.
So at home I do have just whenever I need it.
Okay. So right now you're not experiencing shortness of breath, but say you got up to the restroom and come back,
and then I would probably
be a little short of breath. Okay, very good. So we can say that she is short of breath on exertion. Okay. And we'll say moderate exertion, up to the bathroom and then back. Do you smoke at all?
I do.
Okay. So you said that you do wear oxygen at home, so that would be a concern. It's very important that you don't smoke while you're wearing the oxygen. Okay, it is very flammable. We don't want you to cause a fire or something like that. So it's very important that you explain to your family as well not to be smoking, while you're wearing the oxygen. Okay. I do have the supplemental oxygen up here, so if you do experience any shortness of breath, anything like that, I'd like you to tell me. Okay. The reason that these kind of go together, the cardiovascular system and cardiopulmonary system, both go hand in hand. Okay, so patients that have congestive heart failure, sometimes what happens is that left side, sometimes if that fluid is not pumping effectively through the heart, that's going to build up. Okay, where that goes is into the lungs. So in that situation, oftentimes patients may have a buildup of fluid on their lungs, making them feel short of breath. Okay, so that's why it's very important at the beginning of your cardiovascular assessment that you assess their respiratory status. Okay, I wouldn't go ahead and continue if she was short of breath. Okay, she's non-labored. We're going to go ahead and continue on. Okay, so next thing that I'm going to go ahead and do is just kind of take a peek at your chest here. Have you had any cardiac surgeries?
I haven't.
Okay, are you experiencing any chest pain right now?
No.
Okay, and it doesn't look like you've got any pacemakers, defibrillators, nothing like that.
No.
Okay.
No.
Any other family history of heart conditions?
I think my grandfather had heart disease when he was younger.
Okay.
And
Okay.
then hypertension runs in everyone.
Runs in the family.
Mhm.
Okay, and I see that you've got that as well.
Right.
Okay, very good. Well, I'm going to go ahead and just take a listen to your heart here. And there's 4 different spots that I'm going to listen to. Don't be alarmed, it's just included in the focused assessment. Okay? So first place, and I'm going to listen skin on skin, is going to be the aortic. Okay, that's going to be second intercostal space on the right, right on the sternum. Okay, so I would auscultate and I would be listening for S1, S2, making sure that everything sounds okay, there's no additional heart sounds. Next, I'm going to go ahead and move over to tricuspid, which is second intercostal space down on the left. I would auscultate there. I'm going to go ahead and move on down to the 4th or 5th intercostal space, right on the sternum, and that's going to be, so aortic, pulmonic is second intercostal space on the left. Tricuspid is the 4th or 5th. Okay. Next, I'm going to go ahead and move on over to the mitral or apical pulse. And I'm going to listen there for a full minute. Okay, again, just to make sure that that pulse rate is good, everything sounds good. And we can say at this point she is S1, S2. There's no additional heart sounds. Are you experiencing any palpitations? Does it feel like your heart's racing?
Only when I get up to go to the bathroom and come back, then I can feel my heart a little bit more,
Okay.
but not right now.
Okay,
no.
very good. And we can see, or when auscultating, I didn't hear any murmurs. Okay, nothing else that way. Why I do have my stethoscope, I'm going to go ahead and take a listen to your lung sounds. Again, I want to assess to see if there's any crackles in her lungs, anything that would tell me that that fluid has backed up into her lungs. Okay, so I'm going to listen to lung sounds on the front. Again, I'm going to listen skin on skin. And I'm going to go side to side, okay, back and forth, across and down, at least 6 to 8 spots on the front. Okay, so you've got 2, 2, 2. I'm going to kind of come up underneath the breaths on each side, still over the lung fields there, and I'm going to auscultate. Okay, then I'm going to listen posteriorly, in between the scapula on each side. I'm going to move across as I go down, and about 8 to 10 spots on the back as well. Okay, now remember, that can be very difficult if the patient's short of breath, so you may need to give them a break before you go ahead and come around to the back side. Okay, Brooke, are you experiencing a cough?
I have. I've been coughing here and there, especially when I get up to the bathroom and I'm a little short of breath. I've noticed that I cough a lot more.
Okay, anything coming up? Any sputum production? Nothing like that?
I can't get anything
dry
out.
cough.
Just
Okay, very good.
something there.
Okay, and you said you've been on the lisinopril for a period of time, correct?
Yes.
You've been on it. Okay. Have you had the cough ever since you've started that, or have you been on that?
Pretty much. I mean, I've noticed it more probably since I've been on it, but I don't really contribute it to that necessarily.
Okay, very good. So that would just be something that kind of may trigger something in your mind that the ACE inhibitor sometimes will cause a cough, a chronic cough. So that may be something that, just to think about, okay? So next thing that I'm going to go ahead and do is go ahead and just look at your lower extremities here. The reason that I want to look at the lower extremities in a cardiovascular assessment, again, everything is connected. So if, for instance, the right side of her heart was not pumping effectively, like it does sometimes with congestive heart failure, that fluid is then going to back up into her legs, okay, or into the body. So I'm going to look for any swelling there. Make sure that you're kind of palpating as you're doing that, feeling for any edema in her legs. Brooke, have you noticed any swelling in your legs over the past several days?
I notice it when I get up to do things around the house if I'm standing for a long time.
Okay.
I notice it a little bit more.
Okay. And sometimes what happens is that blood or that fluid likes to pool in the lower extremities. Okay, so it's very good if you can, while you're at home, when you're resting, go ahead and elevate those lower extremities, sit with your feet up, and really above the level of the heart. We really want to get them up high enough that that's going to push that volume back towards your heart. Okay. So I'm going to go ahead and just palpate her pedal pulses. On patients that have congestive heart failure, sometimes they may have more of a bounding pulse because of the increased fluid volume. At this point, she doesn't. They're just normal, so I would say +2. Okay, I'm going to go ahead and just feel her radial pulses as well. Okay, and they're normal. Okay, +2. I'm going to go ahead and assess capillary refill. Again, that's going to tell us about circulation and how well the blood is circulating in her body. We're going to say that it's less than 3. Okay, so that's very good. Brooke, I can see that the doctor right now has you on a restricted fluid, okay, because of the amount of excess fluid you have right now. So it's very important that we monitor your intake and output very well. Okay. So I've got your pitcher here, and it's marked. I think you can have 1,500 milliliters in a day. So the amount that you have right now currently you're going to have to not get any more until about 3 o'clock this afternoon. So you may
Okay.
kind of, limit as you go through because that's all you'll be able to have.
Now that's
Okay.
just the water, right? So I
That's
can
just the
have
water.
something else then?
No, this is all fluids together. So, and that's all calculated out. We've talked to dietary as well, and they know that you're on a fluid restriction.
Okay, so when I
So
get
you
my
can
lunch
have what's on your
menu,
meal
okay,
tray.
okay.
Yes, just nothing additionally.
Okay,
Okay.
okay.
So if somebody brings something in for outside, it's very important that you don't have a share that drink. Okay. The other thing is a low sodium diet. Okay, we do want to watch your salt intake. What happens with sodium is that retains water. Okay, and you've already got a lot of fluid buildup, and so. It's very important that you don't salt your food, don't put any extra salt on there. Your food may taste a little bland in the beginning, okay? You'll get kind of used to that. There's some things that you can try. There's new salt, which a lot of patients like that pretty well, and there's Mrs. Dash. So those are some additional options that you may try to kind of help with the flavoring, okay? The other thing is from last night and the day before when I look back in your history, I can see that you've had a little bit of a weight gain, okay?
Really?
You have. It's been about 5 pounds.
Oh my goodness.
Yes.
I haven't ate very much.
Okay. Well, what is happening is when you have about a 2-pound weight gain in a day or 5 pounds in a week, that really concerns us simply because that's mainly fluid volume, okay? Just by eating calories and by eating a lot of food, you typically don't gain that weight really in that short period of a time. It would be over a more extended amount of time. So, when we send you home, when the physician does discharge you, it's going to be important to kind of keep track of your weights. Okay, so that way you know if you've gained that weight, to notify your physician. They may want to increase your diuretic or do something for that fluid excess.
So it's just the fluid, it's not like fat or I'm
Right.
gaining weight.
No, it's just the fluid. And so the medication that we're going to be giving you is going to help get that fluid off and your weight will go back down. Okay, at that point. So, yeah, as far as your weight goes, I'll be monitoring that very closely. Same thing with your urinary output. So when you get up to the restroom, it's very important that you do go ahead and urinate in the hat that's in the bathroom. Okay. And I'll come in and empty that periodically. We're just making sure that what you're taking in, you're also getting out. Okay. Are you having any trouble peeing at all?
No, not really. I
Okay.
haven't had
No
any
burning
issues.
frequency, anything
No.
like that. I mean, I know you're going often.
Yes,
Okay.
yes.
That is normal. Okay.
Yes.
That's important with the medication that we're giving you.
Yeah.
Okay. Do you have any questions for me?
I don't think so.
Okay. The other thing that the physician may order if you do perhaps get a lot of swelling in your lower extremities is they may have us put some TED hose on you. Have you ever had that? Ever had those placed before?
I mean, I have hose at home, but I don't know what the TED hose
They're
are.
they're like a thick pantyhose, kind of. They're very thick and they're very tight. And
Okay.
so we'll measure your legs and get the appropriate size. And what that does is it kind of squeezes your legs and pushes that volume back up towards your heart. So it helps with the swelling.
So are they painful? They're not painful.
It's not painful, they're just tight. They're
Okay.
going to be kind of tight on there. Sometimes they can get a little bit hot. At night you don't necessarily have to wear them, but during the day when you're up and active, we'll probably put your TED hose on. Okay? And we can get you another pair for you to, wash. And then you can kind of switch them out. Okay? Any other questions?
I think so.
Okay, well I'm going to go ahead and just wash my hands. I'm going to go prepare your medications and I'll be right back.
Okay.
Okay? Thank you.